Well, good morning, everyone, and thank you for being with us for the public safety. Today is October the 15th, 2020, and thank you for being with us at the Public Safety Committee meeting. We have two topics today. The first is going to be an update about the Emergency Communications Center, the general operations and text to 911. And the second topic will be a briefing on the crime trends and other life safety issues during COVID-19. As always, Susan Farag has prepared an excellent packet for both topics, and I'm going to ask her to lead it off, and then we'll go from there. So, Susan, could you please lead it off for us?
Good morning, everybody. As you stated, for the ECC update, we've got a PowerPoint presentation that staff may want to go through at the end, but I'll just briefly go through the packet. As I stated at the beginning of the packet, the call should be very simple and straightforward for a person who's calling 911. It's obviously a very stressful situation for them, but there is a lot that's going on behind the scenes at the ECC. For people who are not aware, the Emergency Communications Center actually has two physical locations, the Public Safety Communications Center, which is considered primary, but also the alternate Emergency Communications Center, which is a backup. And they are functionally equivalent, and they're used, they're tested on a regular basis. Staff move back and forth, and that's to make sure if there are any upgrades going on or if there are any outages at one of the centers that the other one is working and available to take calls. For the past 8 years, the Emergency Communications Center has been going through a consolidation process, and that has a lot of moving parts. It was originally bifurcated. It was both fire and police department managed. It's still like that, but it's functionally now all consolidated under the police department. And part of that consolidation was to include civilianization of all staff. So they switched a lot of staff over to police in a civilianized measure. Initially, the goal was to also civilianize the uniformed firefighters who do dispatch service for fire calls, fire and rescue calls. That happened a little bit. It's temporarily been put on hold, and we'll get into that in a few minutes. There are also a lot of very complicated changes involving technology and training and call taking and dispatch protocols. Initially, as I'd mentioned before, police call takers took every single call that came into the center. But if a person was asking for fire or rescue, then that got sent over to a fire call taker. So there was this bifurcated step to get it over to the fire side of things. And it was a very, very separate system. They've decided to go to a universal call taker system, which I am happy to report has been completed this calendar year. And they now have universal call takers. But to get to that point, it took a lot of training. It took a lot of training of current staff to get them used to the different types of protocols. It took training of incoming staff. And as you'll see, attrition has been a significant problem. And so there's been ongoing training. They've had to overlap that, and they've had to overlap it in a geographical location where they're actually still taking calls. So it was a very complicated issue to undertake. There is a list on page, if I can find it. A list of all the steps that they've already taken, and that's on page 4. They've implemented new fire and police dispatch protocols. As I said, all operational oversight was transferred to the police. They also implemented a new computer-aided dispatch, which is the computer backbone of the entire system to help take and dispatch the calls. One of the things they did to address attrition issues was to create a new classification series for the public safety emergency communications specialists. That has been implemented, and it has different steps, different levels to reflect better pay for enhanced training and time in service. One of the large capital project expenditures that they underwent was actually purchasing the ECC property in FY17 that had been leased space. That gives the county much more control over the actual footprint and systems and upgrades that they need to do. And what is still ongoing is the new radio system infrastructure project that has projected cutover date of December 2020. There have also been some upgrades.
Susan, can you say that one again, please?
I'm sorry, the radio system infrastructure program, all the radio towers.
But I understand, but the projected
Oh, yes.
date was,
It's projected December 2020. That's for another work session if you want to
right,
get into that a little bit more. There have been a couple of delays on a couple of projects that might impact that actual cut over, but right now I've heard that the delay might be about 30 days.
okay.
There's also been a lot of movement at the state level of regulation with the Emergency System Numbers Board, and the General Assembly has changed a lot of things. They created a commission to advance next generation 911 because that's a new technology change that most systems across the country are moving to reflect internet protocol-based systems, the fact that we can get all kinds of data from mobile phones, not just the voice calls and the text calls, but photos and videos and streaming live and those types of things. And they wanted to be able to make sure that the 911 call centers could keep up with that. And part of that change has increased the 911 fees to $1.25 from $1. And instead of charging each phone bill, they now charge each line. So I carry 5 lines on my family account. They're now all being charged. There are projected state revenues on page 5. They projected $12 million for FY20, but curiously, they only achieved $10.6 million in that. And I believe the General Assembly is going to take a more detailed look at why that's happening. They didn't get as much revenue as they had projected. Within the packet, there's information on the attrition issue. They have approximately 185 staff in the police department side of the ECC, and there are also about 40 or so firefighters at the center as well. Attrition has gone up, even though they've taken some steps like implementing the 911 dispatch program at Montgomery College that had its first year last year, 2019 to 2020. However, they had to temporarily suspend that because of COVID. There were certain classes that had to meet in person and they just couldn't do it. So I'm not really sure if that's had any impact at all on hiring. The call volume was about 800,000 in FY20. Their call response rate for that to answer within 10 seconds was 96%. The phone to police dispatch time was 3 minutes and 29 seconds. And the phone to fire ALS2 dispatch time was on average 3 minutes and 37 seconds. I'm sorry. So there's more information in there about next generation 911 upgrades. I didn't know if the departments wanted to go through the PowerPoint at this point. I can run that.
So thank you, Susan. Chief Jones, welcome. We do see that you're on the call. Did you want to comment on any of this, or what would you like to do, please?
So good morning, Council President Katz, and thanks to the Public Safety Committee. Good morning. I apologize for jumping on a little bit late. Some technical difficulties this morning. But I am going to have Assistant Chief Patil from my shop lead this discussion in ECC, as well as our Interim Director, Cassandra Only. And unfortunately, I have to jump off the call. I've got some other important meetings I've got to jump on. So, and then I will allow Chief Patil as well as Chief Smith to highlight the crime update once you all are done with this. But I'll be on for a little while, but then I'll be leaving you. So thank you.
Thank you, and we appreciate you being here. We know you're leaving us in good hands. I was teaching them before that it took 3 to replace you, but that's all good.
It's all good. Thank you.
We do understand that you're a little busy. I
appreciate that. Thank you, sir. Thank you.
Right.
All right.
So with that, or someone is going to, Susan, you're going to run the PowerPoint. Is that
well? It's up to what Chief Patil wants. I'll
Patil, yes,
follow his lead.
Yes.
Well, good morning, everybody. Council Member Katz and Hucker and Albernas, thank you for taking the time to hear from us today. I'll just overview a couple of things to highlight. One, the success of the ECC and our 911 capabilities is really a team effort, with fire and police, taking it from that first call all the way, through dispatch and getting help to where help is needed. So we're very fortunate to have the partnership that we do and constant communication between our teams to make sure we're getting it right. It's also a constantly evolving process. We're always looking at new technologies. We're looking at how to adapt our protocols, how to train our people better to ever-changing dynamics in both how we receive information and how we can best deliver it. I'm in my last over a year and a half now between being an acting assistant chief and then getting confirmed, having ECC under my purview. I'm, as a citizen and a taxpayer and a police officer, amazed at the amount of technology it takes to keep everything glued together, to be reliable, and to have the backups in place. So we appreciate your time in wanting to know what we do and how we do it. The one thing I will say about our staffing, it continues to be a challenge. The numbers that you have in relation to our vacancies include people we have in training right now. So we actually are really about 46 people down until that next group or the next couple of groups gets trained. So, and we always lose some people kind of along the way. So we have work to do, but our recruiting efforts have improved. We've have started putting some billboards up throughout the region that have gotten some traction, and really been putting an emphasis on the importance of our professional staff hiring at ECC to be as important as a police officer. So we have room to grow there, and we are looking at some other technologies to help, with location-based issues in particular, and continuing to grow. We can, I think, probably pretty quickly run through the PowerPoint because Acting Director Onley could take us through that. We won't spend too much time, and happy to focus on any particular issues that you might want to have follow-up questions about.
Okay, thank you. And I did want to point out that the Chief Scott Goldstein from the fire side is also here, and we're going to hear from him, I know, later in the, unless he has something to say right now. We're good. Okay, thanks.
Okay, good morning, everyone. So the second slide, Susan. Okay, so staffing, as noted in the packet, we have a couple vacancies. We do have interviews scheduled for the training instructor. The social worker position just closed, so we will be scheduling those interviews hopefully by the end of the month. So that talks about vacancies, talks about the attrition within the next 1 to 5 years. We'll have some folks that have the ability to retire. However, we love the industry, so we'll probably stick around a little bit longer. Next slide. All right, for our mandatory overtime hours, unfortunately, it did go up over the past few months due to the pandemic. We've had some staff out on due to COVID, the admin leave, so unfortunately that has increased the overtime hours. Next slide. For the hiring and retention challenges, as Assistant Chief Petito already spoke about, some of the challenges that we have is the background and what we have to make sure that we maintain our standards, let alone the nature of the job is sometimes why people leave. They didn't realize what the job entailed and the stress that comes about with it. One other strategy that we're working on within ECC is how we can do better training-wise and potentially extending our training program within the first initial weeks of training so they could get a better grasp on it. So hopefully that will help us retain folks a little bit more, and having the social worker come on board, I think, will also help. As far as the 911 dispatch program, we've been in discussions with Montgomery College, and unfortunately, due to the pandemic, they did have to cancel their second class. However, what they did do was update another strategy that they're going to employ, meaning keyboarding. You have to know how to type. The job requires it, even though most of these folks know how to text. You still have to know how to use a keyboard. So that's one thing that they're integrating in the program. I think that will be beneficial. We do have a meeting next month on other strategies advertising that class coming up in the spring. Next slide. So the call volume over the past several years, it has fluctuated, but that's definitely it has gone down. For 2020, due to the pandemic, we saw our numbers definitely decrease for call volume starting in March. It picked up again around July 4th because all the events were canceled and people were choosing to hold the rain events.
Ms. Arnley, you're fading in and out every now and then. Most of the time you're good, but every now and then your voice is fading.
Okay, I'll speak up a little bit.
Okay, thank you.
Okay. All right. So 2020, for the calls that we've had, it's been declining due to the pandemic. So with July, though, it increased a little bit because July 4th activities were canceled, and that's where folks were holding their own activities at home, and that's where the calls for service fluctuate on basically what's closed and what's open. So our answer times, they have been steady. Once the pandemic started, we started asking a couple questions before we would send that call for service for responder safety and for safety of those in the household or on the scene. So we're continuing to ask those questions until such time that we feel it's safe enough to no longer ask those COVID questions. Next slide. Universal call taker update. We stopped transferring calls to fire rescue staff this year, February 2nd. Our last employee that was checked off, if you will, as universal call taker was March. As you know, with every learning curve, we continue to do better. We continue to train, whether it be in person, online, or reading articles to get staff up to speed where they need to maintain the skills. Next slide. Next generation 911. Our fiber circuits are already at both sites, which is great because we're ready to go with Next Gen 911. Once we upgrade our phone system, we have continued weekly meetings with our vendor so we can get our phone system upgraded. We have already installed the hardware, so there's just some logistics with the software that we have to figure that out and continue to test it to make sure we're ready to do that. So that will definitely be the first quarter of 2021. With that, with EZNet, it's going to require that our GIS person fix any address anomalies that we come across according to NEMA standards within 72 hours. So we're fully prepared for that. Next slide. Text to 911, we in Montgomery County, we did do a soft launch in April, and the statewide, we were part of that initiative in which we launched in August 20th of this year. We typically average about 3 text to 911 calls daily. We are looking at another tool to be able to translate those text to 911 incidents from English to a different language. So that's something that we're going to be exploring with the state by the end of the month. Next slide. Okay, for the 911 board, of Maryland 911 board, which they're now known as Susan already talked about, the fees are charged per line as opposed to per bill. So that money is now increased. Next slide. And then the transfer of animal services calls. So once again, with the pandemic, we have seen a little bit of decrease in our calls because they have extended their hours to 16 hours a day, Monday through Friday. However, we are still responsible for processing those vicious animal calls and those calls that could have a life safety component and on the weekends. So we have seen a decrease, but not as much probably that we'll see within the coming months when it gets colder. And next slide, I think that's it.
Okay. Thank you. On the last issue, for animal services, I know that Gaithersburg City and I believe Rockville is the same situation. They have their own animal service departments. Do we dispatch for them or do we not?
We do not.
We do not, but we do dispatch for them for Gaithersburg City and Rockville City for the 911 calls.
Correct.
Okay, and for the in the text itself, and I think we always, whenever we're mentioning Next Gen 911, and we really do need to mention that Montgomery County Senator Cheryl Kagan was certainly someone that was a great assistant and assistance in any way possible, so that we could get to literally the next generation. So we want to thank her. If she's listening, we want to thank her as well directly. But on the packet itself, Susan, on page 2, you talk about PSAPs, which I looked up, and that's Public Safety Answering Points. Is that correct?
Yes, it's the Emergency Communications Center. It's just that's the standardized term that's used throughout the nation. So our PSAP is called the ECC.
Well, and that's the reason I brought it up. I wanted to clarify that we do have a PSAP. It's just called something different in Montgomery County. So, yeah. And I don't know whether Chief Patel or others had anything else to add before I turn to my colleagues to see if they have any questions. Please.
The only thing I'd add, sir, is the EZNet that we were referring to. There's a lot of acronyms in our presentation, but the EZNet is a enhanced way of getting location information that'll make us better at what we're doing. So it's just one more technology to improve our quality of service for the county. So looking forward to that.
Okay, thank you. Susan, did you have anything else to?
The one thing I wanted to highlight is the first question that I listed under discussion issues, which deals with the civilianization of the uniformed firefighter dispatch positions. I think it would be helpful if the fire department could just kind of briefly explain what fire dispatch does, because it's pretty different than police dispatch. And then maybe they could get a little bit into what the status is of civilianization and what the future holds, because uniformed firefighters do cost more when they're pulled back on overtime, for sure.
So, Mr. Katz, if you may, I will take Susan's questions and then ask to Assistant Chief Radcliffe. As Susan has outlined in the packet, the transition to universal call taking has been accomplished and is in place. The training initiatives for radio functionality or the civilianization of the fire dispatch operations has been and continues to be a collaboration between Assistant Chief Patel and Assistant Chief Radcliffe and their respective teams. The issues predominantly at hand as we work through this is workload and capacity. The members at the center and what they're able to absorb and then in turn be able to train. So with the numbers of training that's ongoing, it has been the recommendation of all of the staff involved here, as well as the folks that have been brought in to look at this from an external point of view, is that the call taking positions and the positions under CAS need to be in place before we initiate further training for the fire radio functionality. So, Ed, after you digest that, go ahead and jump in there for me.
Yeah, I just want to highlight some of the things that I think is, indicative of the fire rescue and the importance of those folks. The biggest thing that we're seeing is that when the fire rescue folks, a uniformed firefighter, comes up at ECC, they already have a baseline knowledge of fire rescue operations that includes geographical locations such as the Potomac River and Metro. And there's a reason that we send new recruits through recruit class that takes 6 months to just get a baseline. The two classes that we've had the past couple of years, those folks who have come up had an average of 8 years of time in fire rescue. We think that's very valuable and lends to just a more efficient dispatch, as well as they come up with different specialties, qualifications such as the technical rescue, hazmat qualifications, the water rescue, and paramedics. We think those subject matter experts lends to just a more efficient operation for fire rescue. It's also clear that we are very complex the way we dispatch fire rescue. We have around 150 different type of response packages. We don't just send a transport unit to a sick person, and we don't just send a fire truck to a fire. There are certain qualifications and capabilities of not only the units, but also the personnel that we try and mesh together to send the right equipment and the right people, depending on what the caller reports. The units that we have, just a simple example, we have engine companies, but we also have brush engines. We also have rescue engines, paramedic rescue engines. So all of those have different capabilities, and being able to quickly parse out what those are and how those are used, we think is very beneficial. As we get more people checked out who come through ECC that go back out to the field, I think we gain a what we call a system elasticity. If we need additional people at ECC because a major weather event comes into Montgomery County, we're able to pull those people from the field who are already working up to ECC to increase the capacity up here without having to wait for people to get called and come in from home. And finally, I think there's a career development component to this. People that come up to ECC learn a whole nother part of the business, and I think they become better firefighters and paramedics out in the field because of that. Just the ECC staffing up here accounts for about 4% of the total fire rescue complement. But we were looking the other day, and we have about 30% of our chief officers who at one time have come through ECC. So you can read that a couple different ways, but I read that as ECC, having the experience at ECC helps people in their career goals and development, and that benefits not only the department but also the residents of Montgomery County.
Thank you. Chief, anything else in addition? Chief Goldstein. We have a few chiefs on here, so I have to be very careful what I say that. Go ahead, Chief Goldstein.
Not for me, Mr. Katz. I'll ask if anybody else. Thank you.
Thank you.
Mr. Katz, I just wanted to add one thing. As
Sure.
we continue to navigate through this issue, the one piece for the ECC staff, the non-firefighter staff that are up there, part of their career progression was to get this check off to get another level of certification. So they've been kind of stifled from progressing in their career as we work through this. So that's just as we continue to figure out this issue, that's one thing that our folks are really trying to get to that next step. And so we're working hopefully to figure out what's the best path forward.
Very good. Thank you. Councilmember Albornoz.
Thank you. Actually, my first question is are those medals for marathons?
Well, half marathons at best, but yes.
Well, pretty more than I have, that's for sure.
Yeah.
Well, thank you all very much for your continued leadership. I do want to start by, and as Susan said, we may need a deeper dive, but I am concerned and distressed to hear that the radio towers may not be delivered by December. We spent several sessions last year discussing the urgency and the importance of making sure that our first responders have every tool that they need at their disposal. And the way it was described, these towers were in imminent danger of failure. Do we have a sense of, understanding there are delays, how long those delays may be? And we may need to follow up with the memo or discussion if those delays look like they're going to be extended.
Councilmember Albornoz, I just wanted to put it out there. We are in the process of trying to schedule a joint GO and Public Safety Committee work session on that exact subject. So hopefully soon.
Okay.
So, but I'll let I guess Chief Patil.
So I
That's that.
I literally right before this meeting started, I sent an update to our law enforcement, the police department here, and our law enforcement partners. We've had several issues with the radio system over the last several weeks. One, I won't get into too much detail in a public forum like this, but they've all been rectified. Some of it I believe is due to the age of the system. And the last I heard, and again, not a little anecdotal, but I believe that the targeted switchover was supposed to be around Thanksgiving, and now is pushing possibly into early January. And I don't know for sure, but I did hear that one of the issues might have been coordination with the ICC tower work, because it's a state tower that we're putting our equipment on, that some of the coordination issues might have slowed things down a little bit. But again, I would rely on DTS, to give a greater, and since it's their project and they're managing it. But I will tell you that I continue to be very concerned about the status of our radio system. And when we do get the new one online, I have a great degree of confidence in it, given the expansion of both the number of sites as well as the newer technology. But I'm hoping we stay glued together from here to there.
Thank you. I appreciate that. Back to the staffing issue, which I totally understand and respect. These are extraordinarily difficult positions that do ultimately lead in some cases to high turnover, and recruitment is difficult. We had discussions in previous sessions about looking at those requirements, acknowledging we want the highest possible standards, but also acknowledging there may be some wiggle room there to be in line still with best practices, but ensure that these positions are filled. Have we looked at those standards? Has there been further evaluation to determine whether or not we should be, within reason, looking to bring some of them back?
Cass, do you want to speak to that point? And because I know we've done some work both from an age perspective, we're looking, but I'll let Cass, certainly the expert.
Yes, absolutely. So yes, we did scale back. It's required that applicants have a 1-year experience of customer service, and it was post high school. We retracted that because what we are finding that high schoolers have jobs. So we have retracted that. So we are looking at that. One other thing that we are looking at is to, along with the police and fire department, recruitment efforts. And that's where if we start younger, when we were kids, little kids, I want to be a firefighter, I want to be a police officer, we need to get in the minds while they're younger, so then they can make better choices down the road. And that's what we're finding, as well as probably fire and police, that folks are making life choices and it knocks them out because of the background. So that's something that we cannot lower, because they have systems that they have to be able to access, and it's a state requirement. But yes, short answer, yes, we did scale back.
I appreciate that. And just an observation, this isn't perfect, but there are, I think the number now is over 180,000 county residents that have filed for unemployment since March. There are people looking for work. And I've had some conversations with some of my colleagues about exploring a virtual job fair in partnership with WorkSource Montgomery and the Montgomery County Economic Development Corporation. These are good paying jobs, career jobs, challenging to say the least, but immensely rewarding. So I think there's an opportunity there for us to collaborate more explicitly, especially given the time that we're in and the number of people looking for jobs right now. So I'll follow up with you guys on that as we round out the development of this virtual job fair. The other question I had was with regards to, I understand obviously it's incredible, and also I join our chairman in giving a huge shout out to Senator Cheryl Kagan and her leadership over several years on this issue, really remarkable. And we now have the capability on the back end to receive text messages. Is there any need to educate the public on the front end on how best to communicate and how to, when they would like to, access their own cell phones? And is there a difference between whether or not somebody has T-Mobile, Verizon, AT&T on the front end Are there any efforts to educate the community, so that they can more proactively find out about this new technology and resource?
So I'll go ahead and jump in here. So yes, what we did do as a statewide initiative, we did go ahead and publish Maryland is now text to 911 capable, all counties in Maryland. Our Montgomery County, our PIO also put something out, as well as you can text all if you can, text if you, all if you can, text if you can't, initiative. And we also were the only agency in Maryland to publicize that in Spanish.
Nice.
So on our websites on how to go ahead and text, we have had multiple calls since we officially went live with Maryland, people testing it, just to make sure it works. And yes, it works. So we are getting the text incidents, and we continue to push that out amongst that.
And I think to add on to what Cass is saying, just from a standpoint of numbers, like right now we're getting about 3 text-related calls per day, and I asked her in prep for this meeting, thinking, oh, they must be, mainly domestic violence or something where people are, can't talk. And we're actually seeing a variety. There's not one particular call type, but I think we have an opportunity as we do all of our outreach and we do our advocacy. Domestic violence is one very good area, I think, where there's relevance. But as we update our documents and publications and reach out to the community, that this becomes part of our normal vernacular. And so I think you'll see it continue to expand in everything we do with communications.
I appreciate that. My last question for now is, and I appreciate the briefing we received over the tragic incident at Perdido Bay, and I think that it was a productive session with obviously a lot of follow-up. I know within the packet we talk about within the next gen technology, the enhanced GIS mapping capability. And there was a question with regards to the specific incident at Perdido Bay, whether the existing GIS mapping capability was sufficient, and moving forward, will the enhanced ability of NextGen help us in situations like the Potomac River where it's tough to find cell coverage, or in the Ag Reserve, for example, which also has large swaths of minimal 5G technology capability and minimal wireless capability. How would this new technology impact moving forward incidents like Perdido Bay?
I'll let Cass go, and I'm going to follow up after she's done.
Okay, so with the current technology that we have, that's where Rapid SOS is integrated with our CAD system. In addition to that, we are looking at another mapping solution that we're going to the state to request funding for, which is a little bit more advanced. With the EZINet, it's going to provide us quicker and faster anti-alley, more reliability and redundancy. So will it necessarily prevent anything like this occurring again? No. However, what it will provide us is better reliability and faster, and better tools for the call takers to have.
And so building on that, I think, there's the technology piece, there's policy procedure, and then there's human beings involved that all play a role in identifying location and then getting, people to the right place. So a lot of learning points certainly came out of the Loudon incident, and we continue to get better. I actually have been in touch with a colleague of mine from Cincinnati Police who saw the article in the Washington Post about Loudon and reached out to me and said, "Hey, I saw this terrible situation. They've had a similar tragedy with a young man, and so they built a tool within their own agency to take anti-alley information or phase 2 GPS data and actually created a way to deliver that, or at least make it accessible to the officer in the car, so that if it is somebody in the woods or something like that, where sometimes it can be difficult to load a call for where that person is, you also actually, it's one more way. So that's one thing we're going to explore, because we may be able to do it relatively cheap with some consulting without having to go out and buy some $1 million system. But so I think we have to layer every all the different technologies on top of training and policy and protocol to give our responders the best bet to get to where they need to.
That's helpful. I'd actually love to hear from Chief Goldstein from his team. You know, that technology within the vehicles, whether fire and rescue service vehicles, do we need to upgrade that as well to be able to take this new technology on the back end within the GIS mapping, or do we have sufficient capacity within our emergency responder vehicles now to translate what they're getting from dispatch?
Ed, you got that, and it sufficient information is there, Mr. Albernas. Ed?
Yeah, so right now, currently, the units that would be responding, they typically will get a lat long if that's available to them, which they can then plug into their GPS device and get an exact location. In addition, with the use of Rapid SOS, we have implemented a way to quickly take a screenshot of the Rapid SOS and the location of the caller and quickly send that to the responding units. And that's not just on the river. That could be in downtown Silver Spring, where we're not quite sure exactly what the address is, but we have a pretty good pinpoint on the caller.
That's really helpful.
The other thing that technology has pushed us forward is all apparatus are now equipped with a smartphone that's related to the Rapid SOS and an app called Zello. It is a backup to the public safety radio system, but that enables that each officer, each charge paramedic or EMT on an EMS unit is holding an Android style device in which he or she can utilize that to get those updates that Ed talked about, as well as if we're in Seneca Creek State Park or other areas, use that device to help them guide their way down a trail to pinpoint that GPS device before we rely upon the individual providers using traditionally their personal cell devices, but those are now in the apparatus as part of a backup for communications as well.
I appreciate that, and I'm due to take another tour. I remember when I first came into office last year, I was pretty blown away by the technology within the newer vehicles, and would love to catch up again to see how you guys are doing. But I yield back to you, Mr. Chairman. Thank you.
Thank you. And I'm going to call on Vice President Hucker, but and unless he wants to ask this question, I'll ask it afterwards. But if someone could take us through a 911 text, I'm assuming that you just call 911, put in the numbers 911. But if I'm going to turn to Vice President Hucker first, please.
Sure. Do you want to get that answer, Mr. Chairman?
Well, I do, but I mean, I knew you've been waiting patiently, and I didn't want to. You're okay?
I'm curious for the answer. I don't want to assume.
Could someone lead us through? And as part of that, I'm assuming to Councilmember Alberno's question, I'm assuming that you don't know as much from someone who's calling you from a cell phone or texting you from a cell phone. When it's a landline, you know the exact address. When it's not, then you're getting off the where it's pinging from whatever phone, so it's not exact. So do people need to put the actual addresses in? How does that work?
Right. So it's texting. You would put in 911, send. It would come into the call center. It would go to the next available call taker. They would answer the call, and they would ask, okay, are you able to call? If they can't, then they'll finish texting. They will ask, what is the emergency? They will ask the basic questions. They will ask the specific address. If they do not have it, we have the latitude and longitude. We can go ahead and send an incident to that location. We still ask the questions that we ask as if it's a caller, a voice call. And sometimes it does take longer depending what they're calling about.
Okay, thank you. And Ms. Frog is having some technical difficulties as well, and she just texted me, so texting does work. But if I could ask Chief Goldstein, please, the cell phones and the fire apparatus now, you're only budgeted through December. Will you be able to keep those moving forward, or do we need to give you a supplement. Obviously, we don't want you not having them. So would you, and you've jumped on the screen for me, Scott, you were over on one side, you're now on the other. Can you talk about the budget on that, please?
So I will start, and I will segue or provide time to Ms. Silberman from OMB for her opportunity as well. You are correct. As I outlined, these devices were a safety net for the old public safety radio system and the concern that we had around that. The devices are funded through the operating budget through the first half of FY21, which is where the December mark sets in. I'm sure that we will be successful based upon the implementation of the new system. You've had discussions already here today. If that rolls out another 30, 45, or 60 days, that will not be a problem, as these devices are safety-based for the radio system. Internally, OMB and Fire Rescues has had discussions about explaining or demonstrating the value of these devices beyond just the safety nature of radio tower failure. I believe we can demonstrate that. Rachel, off the top of my head, I think that was just over 60,000 for a half a year needed to support that. But the question would be best transferred to Rachel if you were able to. Rachel?
Thanks. Yeah, I don't have the numbers up in front of me at this moment. I can take a look quickly. I think that this is something that certainly will be considered as we develop the 22 budget. And again, I think the amount is something that we would probably look to handle through a CET, CCT at year end, given that it's not a significant amount if it does need to continue through the end of fiscal 21.
And it's my understanding we have funded the police through the full year. So, and though it's not a significant number, which we agree with, it is a significant item. So we certainly want to make sure that that does not fall through the cracks, that there is funds for this purpose. So, anybody, Councilmember Vice President Hucker, I said you were patient. I made you more patient. Go ahead, please.
I grew up learning it's a virtue, Mr. President.
There you go. I have too.
So, no, thank you, and both you and Councilmember Albornoz anticipate a lot of my questions. So I'm going to see what I have left. For the record, I'm equally impressed with the Chiefs medals and grateful to Senator Kagan and concerned about the towers. And I'm glad we're scheduling that joint briefing. On text to 911. Director Onley, I apologize. You were fading in and out a little bit. I heard it's getting translated to Spanish, but were there other languages as well? What's being done?
So it's not being translated yet. The other solution that we are requesting funding for will be able to provide other languages, yes.
Do you know how many?
23.
3?
23.
23. Okay, yeah, that's better than 3. Great. Was that state funding?
Yes.
Great. Okay, thank you. Okay, I got that. Okay, you said you're receiving 3 a day, and the chief too. So I heard a little bit about this, but could you elaborate? What's being done to inform the community that the service is out there? How is that being done? Do you have advertising budget for this? How is it targeted, et cetera?
So we did an initial, there was a soft launch of the program where we didn't make a big to-do about it. And then as we went public, when we had the reliability and we were trying to walk in concert with the rest of the state, we did a press release at that point. And what I think we will be doing going forward is rolling it into the different publications, and material that we put out. And when we do training, when we go out into the community, we go to community meetings, which now is, is online, making that part of our daily vernacular to, when we routinely go into, whether it's an educational environment or whether it's a community environment, and hey, here's what we need to know. Here's how you call the police. Here's who you call in case of this situation. That just becomes part of our fabric. I think our best advertising is when we connect with people in the different ways that we do, and we can certainly look at where there may be an opportunity. I think in coordination with the state, to get that message out, even further, whether it's, in formalized advertising or in other means.
Right. Thank you. And I don't want to, if it's still in sort of the beta version or something, and I don't want to get ahead of your preferred schedule, but is the PIO, the county exec's PIO office involved in this yet?
I don't know specifically. I mean, we're working very close coordination with them on a daily basis. On this particular topic, I'll have to follow up with our PIO and see what that connection is.
Right. Okay. Yeah. No. Obviously they have a very robust operation and very big lists that we could get things to without any additional cost. And then there's obviously the cheap approaches that you're aware of, like ads on our buses and stuff that we don't have enough advertisers for. Has there been any? If I missed this, I apologize. Has there been any demographic analysis of the types of people that are calling in? The narrative is younger people are more likely to text. I don't know if that's still current. Is anybody more likely to text than other people?
I think anecdotally, I would agree with you that I mean, we'll see it at home with our kids, right? Trying to get them to use the phone to talk versus texting. So, but we don't typically ask demographic information of our callers unless it's necessary in a description to be able for a first responder to find the caller. It's not something we routinely ask.
Right. If I remember right, wasn't one of the advantages of this service that it may be used in a situation where the individual doesn't want to make a verbal call, like a hostage or a DV situation like that? And has that come up yet?
Go ahead, Cass.
So we've had a couple calls, a robbery, yes, a domestic violence. We have had those incidents come up where we have received text incidents, yes.
Thank you. Glad to know it's available then. On the attrition, we're 46 positions down now. Is that the highest level we've ever? I know this has been an issue for years, but is this the highest level we've ever had in terms of vacancies?
So 23 of those people are in training. I wouldn't necessarily say it's the highest level. It appears that way because we have more positions available than what we have had in years past. So I think it averages out to what we have had in the past where we are going.
Okay. But the rate of attrition, according to the packet, is more than doubled over the last couple fiscal years since the January 19 briefing. Right. If we're in the bottom 25%, is it PSAPs or PSAPs? Which jurisdiction, you can tell me that, but also which jurisdictions do the best job, and what's your analysis of what they're doing differently?
Really, the smaller centers are better because if you only have 2 or 3 people, they may stay longer. Us being a large PSAP, which is, great. I wouldn't necessarily better. It's different. It's what they do differently. And that's some of the strategies that we're looking at for our training to be able to provide more stability and preparedness for our staff to be able to handle what's coming in.
And the one thing I'll follow up on is I think with a big center, you have, the volume of calls. So then when you also have the staffing issues that we have, it places additional stress on personnel. And they all want to do a good job, and having adequate training, the time to have training, all the issues that are related. And I think one of the things that is emerging in this field is that 911 professionals are being designated public safety professionals, by the state, and I believe the federal government's in that direction as well. And I think there's an opportunity. These conversations have taken place in the prior contract negotiations about working towards a defined benefit plan, which our personnel at ECC don't have, and as that's something I think that those conversations will, I'm sure, will continue, but I think it would be very important for them.
Okay. Does the level of stress correlate to the pace of the number of calls that are coming in, or the level of crime in a community, or something else?
I will say all of the above.
Okay.
I think it really depends. because it fluctuates over time. And it really depends because we got to remember we're human too. So we have stuff going on outside of work, and
Right.
then we have to come to work, and then we're processing the calls and dealing and dispatching those calls to the first responders. And we never know what we're going to get, right? So, and that's why the preparedness is very important to be able to, whether it's an active shooter, whether it's a cardiac arrest, regardless of the type of call that may come in, we have got to be prepared because you just don't know what's going to happen the day you come to work.
Right. So, no, I appreciate that. Our higher crime jurisdiction, I mean, if we're in, it just surprises me when we're in the bottom 25% of PSAPs in Maryland. Are Baltimore and Prince George's, say, doing better than we are on retention, even though they're higher crime jurisdictions?
No, I wouldn't say they're better, and actually PSAPs look to us because we have annual shift picks where our staff can pick the shift that they want to work for the year. And you know, it is amazing that we do talk to the different PSAPs to see what they do to strategize. Just like guaranteed leave, our folks have that. The other PSAPs don't. So we do have some things that do keep our staff around. I wouldn't say necessarily that it's dealing with the crime rate per se, because you just don't know what's going to come into the center.
Right. Okay. And can you, the social worker listed under the direct, that's the one we just added this year, right? Okay. I don't trust my memory. Okay. Thank you. So it's not that it became vacant. It just became advertised, right? Can you remind me, do we provide reimbursement for behavioral health support for our call takers now, previous to that? And will we, if so, will we continue to, if we have call takers who maybe would feel still uncomfortable seeing a county employee?
Yes, absolutely. So we have the Office of Stress Management that's available. We have our peer support team. We have employee assistance program, and then they can also go to their own provider. The social worker is going to provide just that on-site presence and be able to help those at that time that may need it, but also to develop the relationships with the staff to have those check-ins. So yes, the services will still be available to all staff.
Okay, thank you. And on the contributing factors that are listed in the packet from the executive staff, background checks, the nature of the job, and the stress. The background checks really just affects the recruitment, right? The other two affect the retention. But was pay not listed by executive staff as one of the driving factors? Because I thought I remembered we paid less than surrounding jurisdictions, who also are under stress, presumably.
Right. And, you know, if anything, and that's where people continue to look at pay, you know, and that's why we have our series at different levels to increase the pay level. So yes, it is a factor, but not an overarching factor, because they do look at benefits. They do look at the other benefits that the county provides as opposed to other jurisdictions.
Okay. Thank you all. Very helpful. Thank you, Mr. Chairman.
Thank you. And unless there's any other questions, Susan, do you have anything else to add? If not, we're going to go on to the second topic.
I don't. I just wanted to let you know I'm having internet issues, and I don't think I'll be able to run the Fire PowerPoint for the next item. I don't know if Fire is able to do that from one of their screens.
Well, Susan, is it? I'm not an IT expert, but is it your choice deliberately to have two? Because I see two of you, so I wonder if one cutting into the other.
No, it's not my choice. I'm having computer issues, so.
Great.
So I switched to my iPad.
I got you. Okay.
Are better than one.
Yeah. And I don't want to make you feel bad, Vice President Hucker. I too see two of her. I don't want you to think that it's just you. Okay. Well, with that, Susan, if you were able, and we understand if you cannot at this moment, but if you're able, do you want to lead us through the second packet? How do you want to work that?
Sure, I can set it up for you. We've got both the fire department and the police department here, and it's specifically to COVID. The first to present will be fire. It's crime and life safety issues, but the fire department underwent some serious operational changes to deal with a novel communicable virus that nobody knew very much about, and they implemented a lot of different changes in order to protect both their staff and the patients that they were dealing with. And they've got some information on how they dealt with the surge, how they changed different types of dispatching of units, ALS, BLS, in their paramedic chase cars. They also dealt with, even though they ordered far in advance, because I remember talking to the fire chief that they ordered additional PPE back in January, right before anybody really knew that this was an issue. There still were PPE shortages, so they had to modify how they actually distributed that based on risk. So they've got information on how their operations changed, the outcomes, and what they learned from that. And I feel badly, but is there somebody on the fire side who can run their PowerPoint?
Yeah, absolutely, Susan.
Okay,
I'm
great.
happy to do that.
So I thank you, Susan. I was going to ask Alan, since you're going to be the main voice on this, and to run that. So President Katz and the Mr. Albornoz and Mr. Hucker, the surge, the first wave, or the first practically 7 months of COVID is one that the fire department faced a lot of challenges and adjusted to a very and constantly changing environment. And the men and women of the service must be commended for their flexibility. As things changed, they were actively getting information and how to properly protect themselves, different and changing on a daily basis. So folks that may have worked on Monday came back in on a Thursday. They're 3 days later, and there was new procedures, new information about what level of protective equipment to wear, as well as how to operate. Those folks, some of those changes were created in the midst of shifts. And we implemented every 12-hour process of checking a blog and an information update process, because it did change that rapidly. The amount of information was significant. The work done by Division Chief Charles Bailey, Assistant Chief Alan Bush, who's in charge of the Emergency Medical and Integrated Healthcare section, Division Chief John Kinsley, and a slew of others enabled this organization to address the spike or the surge as we identified it. And now, as we are looking at and heeding a very cautious eye towards the fall, as we see these upticks, and I knew as your public health board, you all have been discussing this actively as well, that the organization is prepared for the fall and the next part. So Alan, if you're ready, go ahead and take it from here.
Sure, thank you. I'll go ahead and try to share my screen. So I'm very honored and humbled to represent the department in talking about how we responded to COVID. As the chief has indicated, it was truly a team effort, and I'm just one of many folks that worked on this, and I think it's fair to say that there's not one facet of our department that this disease and the response to the disease didn't touch. And it was a constant learning environment, and some of the things that we were able to do and to learn, we're still using and expanding upon. So I think it's important to talk about how we planned for this. We, as the chief and Ms. Farag identified, we were looking at PPE levels as far back as January. But in terms of assessing the seriousness of the COVID pandemic and what it would do to us, we had to make some baseline assumptions. So they're on the screen in front of you. So I tried to organize this in terms of different facets of the potential pandemic. So the red lettering indicates things that would affect the health and safety of our personnel. The blue talks about what the expected surge would be, and then the green talks about the healthcare system as a whole. So we knew as early as January that we were potentially looking at not being able to get a resupply of protective equipment for at least 60 days. And in actuality, that stretched out to 90 days and beyond in some cases, depending on what PPE we were talking about. But of particular concern, of course, were N95 respirators and other similar respiratory protection. So we had to take that into account. We looked at the experience in China and in Europe, which were peaking in February, and so we did some extrapolation of what the effects of the pandemic were on the various slices of the population in those countries. And from that, we took as maybe a reasonable worst case scenario that because Montgomery County had a Medicare population of around 100,000 people, that we could expect somewhere in the order of 15,000 seriously ill patients with maybe resulting 3,000 deaths. So we're happy that worst case did not pan out, but we had to start somewhere with our planning. From the University of Washington model, we looked at the projected peaks, and that was actually fairly on the money, even back in February. When they were predicting around the end of April, beginning of May, in terms of the peak, that turned out to be absolutely the case. EMS call volume, so the only American city that we had to go on was New York City. And at the time we were doing our planning, they were reporting call volumes of 150% over their normal flu season call volume. Which is typically our busiest time of the year. So we had to use that as our planning assumption. And then, of course, New York was reporting hospital turnover times of somewhere between 2 to 4 hours. I think we all saw the news reports of people just standing in line waiting for treatment. So based on that, we forecasted that during our daily high, because as we probably all know, 911 calls and incidents don't occur at a level volume throughout the course of the day. But during our daily high, we were anticipating that we would need up to 50 transport units to handle that volume of calls. And we were also forecasting that we would have lots of relatively well patients that were able to be treated in primary care or at home. But that would nonetheless call 911 and require our services. And again, we were basing this on what we were seeing in New York City. So what did we do? So we adopted a stratified level of PPE to correspond with the level of risk. If we had patients that were not coughing or producing aerosols, we were comfortable with a lower level of PPE. If we had patients who were generating aerosols, of course, we had to up our game. We also adjusted our treatment guidelines, and that was ongoing as the chief indicated, sometimes almost daily adjustments. So as we monitored the research that was coming out of New York City and other areas, even Europe, we did things that we hoped were going to better treat the patient and better protect our providers. So one of the things that we did, and I'll refer to it more on the next slide, was we introduced inline filters for all procedures that required aerosols or that created aerosols. In terms of adding to our abilities to address the peaks, we added transport units during our peak usage hours. This was done in large part, if not the vast majority, by our volunteer partners at the LFRDs. Chief Kelly and his staff did a wonderful job of communicating this need, and our volunteer partners really stepped up. And so we can't say enough about the level of participation we got during the surge from those folks. We transitioned all of our transport units to BLS with our ALS providers moved to chase cars. We did this because we were anticipating that our transport units would get tied up at the hospital for multiple hours, and we did not want to tie up our paramedics with low acuity patients, and we wanted to have them available for the next call if needed. We also put into place decontamination crews at each county hospital, and the reason for that was to get a uniform level of cleansing of each ambulance after every transport. The thought also was that the ambulance crew themselves would be busy inside. They would be waiting for the hospital staff to turn over the patient, and this way the decontamination crew could go ahead and clean the ambulance and have it ready to go when the crew was ready for service. And then we also put a destination control officer that we called EMS 700 at our ECC. That person was responsible for taking almost, well, let's see, every 3 hours our hospital partners were updating us on their status. So we were monitoring ICU beds, we were monitoring the number of patients that were waiting in the emergency room, in the emergency waiting room, etc. And so that individual at ECC was determining where the patients were being transported to. And what we were trying to avoid was overloading any one county hospital. And that program worked very well as well. And then in terms of a healthcare system overload, with our ECC partners, we introduced the viral pandemic triage protocol. At ECC, they did some screening and tried to do some prediction of folks that would be that were worried well and perhaps could be stay at home. That didn't prove to be of great predictive value, but on the other side of the coin, when our crews made it to the scene, they had a protocol that they could follow that would ferret out the patients that were probably better off staying at home or seeking primary care. That was discussed with the patient. It wasn't a mandate, but it was a voluntary thing. And the patients, if they agreed, we took down their cell phone number and other contact information, and then our MIH team followed up with them within 24 to 48 hours to make sure that they were doing okay. And this was actually a pretty, it was very innovative, and it was something that was emulated throughout the state. So we're pretty proud of that. All right, other things that we did in terms of clinical changes. So a PUI is the term that that our state regulatory agency uses to denote patients that are under investigation for infectious diseases. So the same term was used during the Ebola crisis. So I think you could expect to see that again. So early on, the definition of a PUI was pretty dependent on travel history, etc. Of course, as the pandemic broadened, it became more and more encompassing of folks with flu-like illness, etc. We better managed our handoff with the hospital of suspected cases. So we got to a point where our crews were radioing ahead, saying, you know, this is the patient, this is the symptoms they're exhibiting. The hospital would request our crews to wait outside for a few minutes while they prepared a room. Then the patient was able to be brought in, directed to the room while minimizing the time in the hallway. So that got better. We managed airways if we were intubating or giving nebulized medications. All of these things included inline filters, which was a great enhancement over what we were doing before. One of the things that we were paying attention to early on was patients being placed on ventilators, and we knew that ventilators were in short supply in the hospital. Some of the research that came out from New York City and other places that were hit earlier talked about placing patients on their stomachs and proning them to try to recruit more surface area in the lungs. And that was actually pretty successful on a national basis. And so we started doing that as well in the pre-hospital environment. Our cardiac arrest and termination of resuscitation guidelines were modified to be a little bit more liberal in terms of what presenting rhythms the patients were allowed to be terminated with. Indeed, one of the things that we saw was that we ran a bit more cardiac arrests, but our resuscitation rates plummeted. We were seeing patients that were a lot sicker than we had seen in previous months. And then more recently, over the summer months, we launched a pilot program with the cooperation of the Medical Examiner's Office and MIMS to test terminated of resuscitation patients for COVID. This is being done to this date. We've tested probably 120 or so and come up with 8 positive patients that wouldn't have been identified otherwise. And that was really one of the things when we talk about the true picture of how many deaths that resulted from COVID in Montgomery County. I think one of the things is we truly don't know. A lot of the patients that were that went into cardiac arrest and were pronounced were never tested for COVID. They weren't tested by us, and they weren't tested by the ME's office. So we know that there's about 811 official deaths at this point, but there's probably more that we're just not aware of. So our experience, the surge that we were expecting to have happen really didn't. One of the things that happened that we weren't expecting was the public just stopped calling 911 for less serious incidents. As a matter of fact, I think the citizens took it to heart that the hospitals were to be reserved for the more serious cases. And they were also afraid of going to the hospitals because they did not want to catch the disease. So in terms of our call volume overall and in EMS, we saw our call volume decrease. We did experience the expected surge about the time that we thought we would. At the latter part of April, early part of May, we were transporting somewhere in the order of 40 to 50 COVID positive patients to the emergency rooms on a daily basis. That, of course, has greatly tapered off. So I won't bore you with going over the graph in detail. I think it's pretty self-explanatory, but I think the take-home message is that at least for the surge that we experienced, the overall call volume was down, but the severity of the patients was up. In terms of what we saw at the hospitals, they truly did experience a surge. The number of beds that were available for COVID patients was greatly increased by the hospitals canceling elective procedures and rededicating spaces in their facilities for the care of COVID patients. So when you see something like the figure around May 9th of 500 total hospital beds in Montgomery County being occupied by COVID patients, I think it's important to bear in mind that that's the vast majority of total hospital beds that are available. And of course, we've seen that number greatly decrease as well. But I think from a healthcare system perspective, our ability to cooperate with the hospitals and with our HHS partners to try to monitor this and provide each other with data was a huge success and one that we're continuing as we speak. So how did we do? Because of our efforts to stratify our risk levels, we did not run out of PPE. I think that our logistics folks who had to be augmented during this crisis, did an outstanding job of getting PPE wherever they could and then distributing it out throughout our fleet. And that was a daily struggle, really. You know, they don't want to win a whole lot of awards for that, but I would be really remiss if I just didn't mention that that was really important work and it was done well. Very few of our employees became sick due to COVID-19 exposures at work. We know that we had some employees that had to go off because they were COVID positive, but I think for the most part we were pretty fortunate that we didn't have more problems with that in terms of workplace exposure. We transported over 1,500 confirmed cases of COVID, and this is coming from the state health department and the hospitals. And we engaged in a robust effort to try to inform our workforce of that in as close to real time as we could. But that's a lot of people. And as I said, there's probably more than we know, and they just weren't tested and they just weren't confirmed. Our ALS response times did not get worse, so we were very happy about that. Our hospitals did surge very hard. As I indicated, the number of hospital beds that were dedicated to COVID patients alone was pretty high, but our cycle times remain manageable, and we never ran out of transport units or other resources. So again, I think we could consider that a success. Our cardiac arrest save rate, which is something that we monitor very closely and we're very proud of, as I indicated, that plummeted, and most of these cases, at least during the surge, were not tested for COVID-19, so we're unable to say whether that was a factor or not. So I appreciate your time and attention, and that's the end of my PowerPoint, but I'm more than happy to entertain any questions that you have.
Thank you very much.
For a second. Thank you, Alan, for that. And Alan's very humble in the presentation and the information there. As I said, it was a huge amount of work. And one of the things that the pandemic created and demonstrated was the partnership amongst the county agencies. When we talk about protective equipment, it was and continues this day to be a partnership with General Services, Emergency Management, and Health and Human Services. So the effort that Jamie Cook took on and General Services to be the clearinghouse and the recipient for protective equipment is one that is amazing and has made all of our processes work together. So the work between Dr. Gales, Dr. Bridgers, and Sean at Public Health, Earl and his folks at Emergency Management, and then the General Services team that got thrusted into being N95 and gloves and all of the other PPE parts. They enabled my logistics folks, like Alan talked about, to deal with the changes within the EMS supply chain. One of the unique nature of that change is what was a very well-structured, just-in-time drop ship delivery process and a supply chain to our 37 work sites was changed by the providers, the suppliers, the vendors. They obviously had to refocus how they did their support of their customers, and we ended up creating a daily shuttle process of providing restock PPE equipment to each station on a daily basis, and sometimes more than that, because of what was provided to us, but also how we had to have a central receiving operation. So the second of both General Services and that team, and as Alan outlined, the volunteer support and the additional surge ambulances was paramount, as we did see and did react to a very higher call volume, and were able to support that over a good 60-day period. So thank you, Alan, for that information, and I pass back to you, Mr. Katz.
Thank you very much. A couple questions for you for the discussion issues. One of them is some epidemiologists are predicting another COVID-19 surge during the winter. How is MCFRS preparing for the possibility, and are there any additional resources needed?
The preparation is ongoing, hasn't changed. It didn't slack off in June and has not needed to pick back up. As we look through this, we have changed our processes on cleaning or decontamination. We're still moving forward with that. We still are moderating our use of protective equipment and making sure that we have the right supplies for the right patient encounters and the activities. The organization has done a great deal of change on our outreach and our training processes, because our training academy had to transition to, as you would have, a virtual training model in a lot of activities, and engineering the hands-on and in-person training that could not go virtual into other activities. So the latter question of what resources are needed, the departments throughout the county government are working collaboratively and working together. So as we changed fit testing and changed our N95 supply from one model to another model, collaboration between those organizations has shined and is still working together. So nothing's needed at this time.
Thank you. And prior to COVID-19, you implemented, MCFRS implemented a new alternative destination protocol pilot program where EMS transported individuals to certain urgent care facilities rather than to emergency departments. What was the status of that program during COVID? Is there something that can be used again, excuse me, if the region experiences another COVID surge, and are urgent cares reluctant or not equipped to participate?
That's a mouthful of questions. Yes, alternative destinations, or ADP, was implemented just prior to the pandemic hitting, with a focus in the Silver Spring Four Corners with a right time facility there. Alan can pick it up from here as we are pushing forward, but that is a very moderate push. So Alan.
Okay.
Yeah, so I think the chief is right. We had started with a regional focus with more or less a pilot program. We're preparing to roll that out countywide as we move closer to the implementation date of ET3, which is a Medicare Administration initiative. We did have a few transports during the surge to urgent care centers, especially with some patients that were very reluctant to go to the hospital and felt that the urgent care centers were less risky of a place to go. I think that overall what we saw during the pandemic, especially during the surge, was the people that were less sick and didn't need to go to the hospital and didn't call 911 drove themselves to the urgent care centers and took advantage of that capability in that manner. And so I don't think that the urgent care centers are reluctant to participate. In some instances, some of them were a better place to go for COVID testing and the like. But it just all has to do with public behavior. But I think it's a great question.
Okay. And Councilmember Albornoz, please.
Thank you, Mr. Chairman. And my hat's off to the team. Unbelievable response, and the way that you shifted to address the ongoing PPE issues and everything related to that and so much more is just a testament to the dedication of our first responders here in Montgomery County. So thank you for your leadership, and thank you especially to our frontline personnel for all they've done and all they continue to do. You know, one of the things that kept me up at night during the surge was what we would do if a large enough percentage of our first responders called out sick. I know that in New York City, at one point, more than a quarter of their police department, and I'm not sure what the number was within fire and rescue, but had the disease or because of contact tracing had to stay home and were not able to go to work. What sorts of personnel, and as we've learned from the White House and sports teams, you can have all of the best PPE and well, I don't know about the White House, but and within sports teams, you can have really strong procedures in place and still have outbreaks. And so within fire stations and police districts, when that happens, and because of exposure, what is the plan to help address emergency staffing issues as they arise? Because God forbid we have another incident like we had with the flooding that occurred a month ago, or we're about to enter into the winter season with snowstorms where it's difficult to get frontline personnel to work in the first place. What's the plan if, God forbid, we have outbreaks within fire stations and police precincts?
So I will start that out and then ask John to pick it up through operations as they created that plan. Absolutely, the parameters that Alan mentioned, we did base and assume and predict that we would have a circumstance like that, where we were having a 10 or then 20% reduction in workforce availability. And when we could not sustain the 308 daily position count, what we would do and what the steps for that were. So we had done a bird flu or a avian flu plan before that we brought out and dusted off and picked up and applied. And the focus of and the attention to risk management was paramount and remains paramount. We still have risk controls in place, limiting the number of personnel that are enabled to ride on the apparatus. During the beginning of the pandemic, we limited the number of personnel that would be in the station to those that were actually riding so as to limit their potential exposure. If you weren't riding, if you were not providing service that night, that period of time, we asked that they not be in the station. So John can segue from there, and it is a risk management perspective and focus that has driven the vast majority of our operational decisions and still does that today. John?
Yeah, there was actually a research paper done maybe 10, 15 years ago on fire departments in the National Capital Region, and it examined the workforce's willingness to come into work should there be a pandemic. And the bottom line that was learned from that was that probably about a third of your workforce would get sick from the pandemic, and another third would be unwilling to come into work because of fear of getting sick or wanting to protect their families from getting sick by something they caught at work. So thinking that was going to be a reality, despite all of the protective measures that we put in place, our last resort effort was to convert our current workforce of 24-hour shifts, 1 day on, 2 days off, plus a few stations where we have day work. We were going to put our workforce on a red team, blue team schedule. So we took the entire workforce and divided them up into basically two fire departments. One would work 24 hours, the other was off. The next one would come in and work for 24 hours, and we would just switch. So that kind of brought a large number of folks, minus all the sick and unable to come to work, down into a smaller total workforce that we would divide between two shifts. So we do have that plan in the file cabinet, along with the plans from everything we did in the spring and the summer, all ready to dust off and use should we see a surge come this winter. I will give some kudos to Chief Bush and his staff. They created some remarkable monitoring tools. They monitor this on a daily basis, multiple data sources, and we use that as a management tool to look at what's happening currently in the trends. And I think if we see a surge come at us again, we're going to know about it well in advance and be able to put our plans back in place and respond to it.
Thank you. I appreciate it. That's really helpful. And then I know that now PPE is not obviously the same issue that it was before, but there were some specific elements of PPE, the N95 masks, which were so difficult to get your hands on, no longer the case now. But in terms of the PPE, do you guys feel confident that if there is another surge, there is a sufficient set of supply, not just generally, but in the specific areas that you think you would need?
So the PPE demands have changed and fluctuated. So on the N95 or the tight-fitting respirator, that has stabilized, and there's a good quantity available to us there. The latest situation has become gloves, become medical grade gloves, and the availability for those. And we're focusing and working with all of those partners to keep that process coming. In between, we had some challenges on the isolation gowns or the barriers that we put on to protect the firefighters' clothing from the droplet and the moisture protection. So it is absolutely still a active concern, and it is one that will remain that way as we go through this process, because some of the supply chains don't predict returning to normal in the supply chain process or the supply flow for probably over another year. So it is one that still is high at hand. To expand on the other point about our staffing, our workforce is one that the CDC circumstances and the high risk employee base is very low because of the infectious diseases, the communicable diseases, and the stress in the work environment in the fire rescue work field. The number of folks that are providers in fire rescue, career and volunteer, that fell into the high risk categories or into multiple of the high risk categories as CDC outlined is very low. We still have a handful of folks that are off because they or family members are at high risk, and that is a great benefit that the workforce has been provided, but that is one that has not affected fire rescue as it has some of the other county agencies, because our workforce is much different in their composition. So it's a part of our staffing factors.
Thank you. I appreciate that. Mr. Chairman, I yield back to you.
Thank you very much. Councilman, we're going to move on to police, the crime data, but Councilmember Hucker, did you have anything at this point?
Only to add my thanks for this extraordinary response during such a difficult time, guys. Your response is great, and this briefing is really helpful as well. So my hats off to all of you. I think that all the questions have been asked, but really appreciate all your service.
Thank you. And again, we all thank each and every one of you for everything you do, not just during this time, obviously. We're going to turn now to the Montgomery County Police Department crime data. Ms. Farag, would you like to lead that part off?
Sure. This was prompted by another council member requesting some information on some behavioral changes that their constituents have noted in the neighborhood, particularly what they were calling drag racing. Yep. And I also wanted to note, in the news everywhere, it seems that major urban areas are experiencing an uptick in certain violent crimes, while other types of crime are going down during COVID because people's behavioral patterns have changed so significantly. So the department's going to go over some information about what's changed during COVID, as well as what's changed year to year in terms of crime trends. Some of the things I just wanted to have the council members keep in the back of their minds as they're going through this is There have been a lot of reported carjackings recently. And there's also been a lot of talk about retrieving ghost guns from the street, which are guns that people can manufacture on their own. And so Chief Patil and Chief Smith, I believe, will go through this. And we are going to, the Public Safety Committee is going to have a very in-depth briefing on traffic enforcement on October 29th. So while Assistant Chief Diadone is here and can answer some questions, that will also be an opportunity to get more in depth about what's been going on in the county.
Okay, thank you. Chief Diadone, if you could address, and we're going to address it again, but Councilmember Navarro had brought it to all of our attention. All of us were aware of it, but she certainly brought it to all of our attention about the drag racing, and we've seen the horrible example of it in Gaithersburg a couple months ago. I guess it's a month or so ago. Can you discuss that? We're going to discuss it in depth, but I just wanted to know if you could bring us up to speed. I shouldn't say up to speed. Bring us up to the area. Okay.
Yeah, I'll give you the USA Today.
Okay.
For today, we'll go more detailed there. You know, one of the anticipated outcomes of COVID was we had lower traffic volumes on the roadway, and we anticipated after we started off with, in our Vision Zero campaign and having, a very high number of crashes early on in the season, we thought that, one of the positive outcomes of COVID was we really have fewer traffic crashes. Unfortunately, that is not the case. One of the anticipated outcomes was the lower traffic volume and then the lower police response, because like you talked about with the fire department, we had officers on reserve waiting for the COVID wave surge to hit. We had less officers actively on the road conducting traffic enforcement. We saw that speeds increased at a very high rate, and we had high speed-related crashes. We had speeds over 100 miles an hour detected, and we immediately countered that by moving most of our automated enforcement cameras onto the locations where we're authorized on arterial roadways to combat that. As a result, the trend that we saw was single vehicle crashes with the enormous high speeds and with alcohol and seatbelts being contributing factors in the crash. In fact, we have currently 28 fatal crashes with 30 deaths, 11 pedestrians, and alcohol is a factor in about 1/3 of this. So what we saw is with the lower police response, we saw a negative response by the driving community. And last year we had 33 fatal crashes. So we're already ready to ellipse it when we should have had 4 months of lower crash rates, and we should have retrieved. So the perceptions from the community about high speeds and, quote, drag racing is probably accurate and perceived. However, speeding has been an epidemic on our arterial roadways for the 35 years that I have been here. Montgomery County Police has gone out and re-engaged, and the largest complaints have occurred countywide. The largest complaints have been in the Wheaton districts, and I think it's more of a coordinated community response, where it was in George Avenue, Connecticut Avenue, Beers Mill, along the ICC by the Lay Hill community. And I have to say that Commander Yamada has been extremely responsive with the limited resources that he's had. In addition to the automated enforcement, he has put his traffic squad, which returned back from the COVID telework situation, to monitor the major arterials, focusing on high visibility patrol. He also has put his decentralized community action team to focus on the loud mufflers and the equipment violations that were made contributing to the complaints. We are coordinating this with Maryland Transportation Authority so that it's a cooperative effort. And we recently updated our MOU, which allows MDTA to have traffic enforcement authority in the county as they traverse it. Before they had a 1 mile restriction. So if they see a traffic violation as they're leaving the ICC going to get gas or whatever, they can jump in and help us. So that's a part we got going on there. One of the other things that we saw is the fact that we've had what's called meetups and car rallies. Burtonsville was a big one. Downtown Silver Spring, we've seen them occasionally. Up county around the park and ride off 124. And what it is, it's a group of people, which I'd say about 90% are legitimately, they just want to socially connect and network. And they get together and they show their cars and they walk around and talk. But then there's the 10% of them that wants to do the reckless driving, spinning wheels, drag racing, going fast. So what we put together is a multi-jurisdictional approach to this, which MSP, MDTA, City of Gaithersburg, Rockville, and Montgomery County Police are all working together. Our alcohol unit is coordinating primarily, but all the districts have a blueprint for response. And when we get information and intelligence of these car rallies, our first response is to go to the car rallies and just create a presence and be a positive influence in this case, because we want to encourage them to, be able to meet and have a social interactive that's safe. But as they leave these car rallies and they begin their aggressive driving, we have enforcement campaigns on the arterial roadways to address this, as well as doing the enforcement of the loud mufflers. These are aftermarkets. These are these small cars that really shouldn't be very loud at all, but they put the loud exhaust on there just to make them sound cool, I guess. And so it's illegal, so we do equipment repair orders to get that fixed. And we'll go into more about equipment repair orders out there. So overall, this is a quality of life experience. We are not going to solve this in 2 months, 3 months, 6 months. It has grown to an excessive proportion because of the outcome of COVID. And as we're working to get our officers to engage, it will take time for us to, return it down to the level that we have been most accustomed to in the county. We are on top of it in all the districts, but it will take time. But we hear the community, we're responding to the community, and we do care because it's part of our Vision Zero package, and we hope to get back to Vision Zero as soon as we possibly can.
Well, thank you, Assistant Chief. I have to tell you, I was on the ICC. It's probably been 2 months ago now, maybe a little longer than that. And a person on a motorcycle came literally flying past me, and how his wheels stayed on the ground was amazing. I mean, it was extremely scary. It really was. And they came from nowhere, and they just literally just flew past me. So
absolutely. We had one of those last night, but his wheels did come off the ground and he didn't survive.
Wow.
Motorcycles are a challenge because we can't actively pursue them because when they flee, they're like worse than a loaded weapon being fired off in the community, right? So they're a challenge. We are working with MSP on strategies. So when these groups come in and try to terrorize, we do try to do enforcement of the motorcycles. You can generally tell the ones that are not that are more inclined to do aggressive driving because they bend their tag down. So that's a violation that we do enforce for the very purpose so that we can look to identify them in the future when they blow by you at 80 miles an hour, 100 miles an hour like they do.
Right. Believe me, I will be more than happy. Councilmember Albornoz, please.
Thank you, Mr. Chairman. And I do want to give a lot of credit and thank Councilmember Navarro for bringing this issue to everyone's attention. We have also received constituent emails and concerns about this issue, and I appreciate the confirmation that there is something to the observations, the anecdotal information we are receiving out there. And it sounds like we're going to dive deeper into this at a future session. But just two quick questions in anticipation of that deeper dive. How sophisticated are these endeavors? Is there gambling? Is there, I know that there are spectators. Is there a regional approach to this? Because I get the sense that the MCPD does a great job of addressing these issues as they arise, taking a lot of proactive steps, but I suspect they probably shift and move around the region. What are we seeing and what are we doing about that aspect of it?
They are. I do not believe it's organized where you've heard in the past where there's money invested. This is more an ad hoc environment. Having been involved in traffic for 20 plus years, what we see is that we've had this experience occur about 5 years ago. And what they do is using social media now, they come up with the meetup locations. So we actually use our intelligence branch under Chief Smith to help us identify when they have the meetups so that we're aware of them. And they do traverse the entire county. Every district gets their share of them. So when we do, we organize this response throughout the jurisdiction. If it's Wednesday through Saturday, our alcohol initiatives unit takes the lead. If it's during the week, then we have the district lieutenants, coordinated response, utilizing DCATs and other community, and implement this plan to discourage it. We also implement strategies when we know they are. It's called channelization. It's a program where we identified it to channelize the roadway down so that officers can make easier observations, but we also are able to slow down the vehicles themselves. And when we see these violations, we can pull them over. So we use these tools and these strategies to try to combat them. But what happens is they get talking in their little groups, and then that's when these guys on the ad hoc will go out there and they'll just try to take off. And when the police are there and being visible, they generally break up on their own, and they don't have the intensity. However, like any crowd with the human nature, if two people start doing it in the parking lot, then other people get the idea and it becomes addictive. So we're using the high visibility approach. We're as they are operating legally, we're being positive, encouraging them, but we are looking to take aggressive action when we see aggressive driving and those traffic violations, as well as addressing the obviously equipment-related failures.
I appreciate that. There was also an ancillary issue in some cases of fireworks, and we'll get into this as at the next session. But I do have some additional questions regarding this. But I know Councilmember Navarro will want to join the session too when we have those discussions. So I'll defer to that session.
If you have things you want to specifically that you or Councilmember Hucker or Katz would like additionally answered on there, go ahead and please send them to me so I can. If it's data or research or anything, I'll have time to prepare them for you as well, even if I have to send it to you on the sidebar.
You got it. Super helpful. Thank you.
Thank you. Councilmember Hucker, I can't follow what your text has told me. So.
I didn't have any additional ones for fire. Thank you, sir. And I think I'm good on the traffic. I can wait till the dedicated session on that.
Okay. Thanks. Assistant Chief Patel or Assistant Chief Smith, did you have anything else to add, please?
Tom is certainly our expert on traffic, so I'll defer to him on that. But in the conversation with my colleague from Cincinnati, they're having the same issue in their city streets. Motorcycles, ATVs, and people driving at extreme speeds in those areas. So I think it's a problem, again, like Tom said, as COVID has pulled us back from certain duties, we have to, reset. So, but Tom's certainly our expert. And so I'm ready whenever you want to discuss the crime status.
Sure, please. Go right ahead, please.
So, much like the fire department, I won't get into a heavy amount of detail, but we absolutely changed our response and operations. We transferred certain calls, which is actually part of a turn the curve project before, about transferring more calls to our telephone reporting unit. We accelerated that program so that officers didn't have to take minor reports and then expose themselves to greater COVID hazard. And that program has gone very well, and it was a way to keep people safe and focus on some of those more important issues. We started conducting remote roll calls in the parking lot. We've kept people out of the building, so we've done pretty well as far as keeping our staff safe. And as it relates to crime, we saw a very distinct drop in calls for service initially once the pandemic hit. I think we all thought that people would get tired of being cooped up together and those calls would actually jump, but they didn't. So the calls stayed relatively low, and officers were certainly focused on priority events and certainly maintaining their health and without getting in all the. I think the fire department did a great job covering the PPE situation. I also want to thank DGS as well. So we continue, much like them out in the field, we don't know what we're walking into, so having the proper PPE is also always important. Just going through most of our crime categories, our statistics for this year from 2019 to 2020, and now, unfortunately, as we all know, 2020, most of it has been COVID. Right at this point. But most of our crime categories are down, other than homicide, and Chief Smith will certainly speak to that. And our aggravated assaults are up as well as it relates to, we've had several shootings, and that goes to some of the gun issues that we're going to talk about as well. And, we've seen a drop in some of our seizures and drug enforcement efforts, and a lot of those are tied to traffic stops. So as the traffic stops have gone away, also has also the enforcement of drug offenses, our ability to take handguns off the street, although we've been doing a great deal of it in the scheme of things. Those traffic stops are situations where a lot of that occurs. And in the meantime, our opioid issues have increased, which is obviously of great concern. And there's been some, anecdotal, discussion of why that's happened. But, people, stuck at home during this thing and going through their own struggles, it's been a factor. The other thing, and on the property crime side of the house, we have seen an increase in auto theft, commercial burglary. The residential burglaries are down. People are home more, right? So where oftentimes our residential burglaries would take place during the day, you're not at home, the kids are at school. That has gone down 8.4%, but conversely, commercial burglary, has gone up almost 30%. Auto thefts 29.4%. And then theft from autos, also another rise, 18%. And our one of our biggest factors with theft from autos and crimes like that and related to auto theft are people leaving their cars unlocked. It's a nonstop campaign for us to get that word out. People leave their cars unlocked. They then are sometimes leaving spare key fobs in the cars. The perpetrators have learned that this is a good tactic to get cars, and oftentimes it can also lead to a garage door opener being in there or a house key, and then it leads to other crimes. So we really have had a great deal of issues related to that ongoing, but I think with more people just being home and around, that has also been a factor. For domestic violence, we're actually, down. I think that there was this belief that there will be a greater level of domestic violence. And of course, we only know what we know. So if people aren't calling because they can't, and this is an interesting conversation with the whole text concept, so getting that communication out to people to understand that that is a particular area, if they are being abused or if there are domestic issues going on, what we know is our numbers are down, and Chief Smith will talk about some issues that we're seeing over there. But also, what we don't know is if people aren't able to call us, is that a factor? So we're keeping an open eye to that. And I'm going to turn over to Chief Smith because there's particular issues related to the homicides, the shootings, gun recoveries, ghost guns, and we'll tag team whatever we need to here. So, Ron?
Sure.
Thank you.
And I'll jump in and dovetail on what AC Patel has already talked about. when the crisis first started, what we did see is a very noticeable uptick in severe or more violent domestic violence cases that were being investigated by our domestic violence unit in the Special Victims Investigations Division. And what we were seeing were increased cases where serious assaults were occurring, strangulation, which as of October 1st is now a felony in Maryland. So that's going to increase the caseload. But we were seeing more and more of those cases. Anecdotally, what we were also seeing is more cases turning up in our hospitals involving child abuse with more serious outcomes, the more serious physical abuse cases. And but we weren't getting other reports. And part of the reason behind that was without school being in session, children going to aftercare, the mandated reporters who in many cases would intercede on behalf of our children were not in contact with them. So therefore, the abusers, both on the adult side of the house and also on the juvenile side of the house, were at home with their primary abusers. What we did attempt to do, working with our partners at the Family Justice Center early on, going back as early as April, is to increase the level of awareness in the community of domestic violence, and also offering the services that are available through the Family Justice Center to people in need of assistance. We proactively started reaching out to known victims of abuse who were still residing with their primary abusers, contacting them through non-governmental organizations and non-police entities so that it would not raise the antenna of the primary abuser, but to reach out to these folks to let them know that we were concerned about them and that we would do what we could to check on them to ensure that their safety was being looked after. So that was an ongoing program. And then what we started seeing is as the months went on, when we got around to like the end of the summer, the numbers as far as serious sexual assaults and domestic assaults started actually dropping down, and they were more in line with the previously reported numbers from last year. So those things are starting to level off. And then we got into the issue that we're now seeing down in the 3rd District in the Silver Spring area with carjackings. Over the last several weeks, going back to about the 25th of August, we noticed a spike in carjackings. What we have also been able to determine is this is a regional trend that is ongoing. While we had 17 events year to date, and the 24 events year to date in the county, 17 of them down in Silver Spring, what we have noticed is from talking to our partners in the Metropolitan Police and also Prince George's County, they have also seen noticeable increases in these categories, double what we're seeing in Montgomery County. What we have been able to preliminarily discern is that these are more crimes of opportunity than they are a concerted effort to carjack people. As AC Patil had touched on earlier, we've been wrestling with for the past year or more an increase in thefts from auto and auto thefts. In most cases, these are crimes of opportunity. And to jump from a theft from auto or an auto theft to a carjacking is basically the use of a weapon or the use of fear or force to intimidate the victim. And in many cases, what we're seeing is people going to convenience stores, service stations, leaving their cars running, the keys are inside, they go in to conduct business, they come out, somebody's in their car, now there's a struggle or some type of interaction, the person's placed in fear of their life, they get out, and now a theft from auto or auto theft migrates into a carjacking. We are working with our centralized detectives in the robbery unit. They're coordinating with Commander Frank and his resources down in the 3rd District. in order to increase the level of awareness in the community, and then also come up with a concerted effort to combat this threat. We are also working regionally with our partners from the Metropolitan Police and the Prince George's County Police Department, because, you know, in certain areas you cross the street or step off the sidewalk and you go from one jurisdiction to another, to share information and raise the level of awareness in the region so that we can work collectively to drive these crimes down. AC Patil also talked about homicides. Year to date, we have 17 homicides. We're ahead of where we were last year, but what's disturbing more so than the fact that people in our community are killing other people is the number of cases, and there's at least 7 where the victim and the suspect are residing in the same home. Husband killing wife, son killing father, stepfather killing stepson or visitor, brother killing brother. It's been an ongoing cycle, and I think it's directly tied to people just being locked into that residence with each other with no other outlets because of their sheltering in place due to the whole COVID crisis. So that's an ongoing kind of trend, a bad trend that we've been monitoring and tracking since COVID took place in Montgomery County.
Thank you. It's a horrible trend. I don't know how someone could combat that. I mean, obviously you're not going to have a police officer in everyone's home.
Absolutely.
So I don't know how you could, I don't know if there's a system, whether the Health and Human Services or whoever, that could help out in that type of a horrible situation.
So one of the things that's going on currently, Council President Katz, is October is Domestic Violence Awareness Month. And working with the Domestic Violence Coordinating Council and the FJC, they've put out a lot of information, and they have a calendar of events that's ongoing throughout the entire month of October, reaching out to people and allowing them to have outlets as to where they can go to resolve their differences in a more holistic way, and hopefully lessening the level of violence that's occurring in homes and in private residences. Because you're right, we can't be everywhere, but hopefully if we offer people those outlets where they can, in a more civil fashion, address their concerns with the people that they're living with, we can, through those means, not through law enforcement, but through community engagement, reduce the level of violence that we're currently experiencing.
And thank you. And did you want to touch on ghost guns? First off, to explain what they are. It's my understanding that it's a gun that is someone themselves makes. I mean, they can have a kit or whatever and make it.
Absolutely. We first started seeing ghost guns, which are not regulated currently under federal law. You can legally buy the parts because they are partially up to 80% assembled. So you can go online and buy the component parts of these weapons. There's some minor milling work and drilling that has to be done in order to assemble all the pieces to make a functional firearm. But we have seen a steady uptick in the county over the past 2 years. One of the first cases that came to light in Montgomery County was literally the day after the shooting at Marjorie Stoneman Douglas High School down in Florida. We had an incident involving a young man who appeared in class at Clarksburg High School. He had a backpack, and a student actually went to school security staff, who then approached our SRO who was on site, and made them aware of an individual carrying a firearm in school. School staff and our SRO worked together to isolate the student with the weapon from other students and other staff members, and then safely get them to the office where they were able to recover that firearm. Additional work was then done by our Firearms Investigations Unit, which led to the fact that we determined this individual had been making other weapons at his home. When a search warrant was served, there were weapons all over the home, and the parents were there. So we've started to see a steady uptick of these because individuals who are otherwise prohibited from legally, possessing firearms can go online, buy component parts, whether, they're being mailed to their parents' address or whatever, and then assemble these weapons. So there's been a steady uptick. It allows prohibited persons access to firearms. It allows for the manufacture of firearms that are otherwise untraceable by any entity such as the ATF, which regulates firearms sales and purchasing throughout the country. So it is a problem that is ongoing and expanding throughout the county. There's not a week that goes by now that we're not seeing one of these turn up somewhere, whether it's on a traffic stop or some other criminal interdiction. Folks from our repeat offenders unit were apprehending a felon the other day, 2 days ago. Everything went off, no issues. The person was taken into custody without incident, but he had a .45 caliber handgun in his waistband when they apprehended him. So this is an ongoing thing that we're now seeing. Montgomery County is evolving from what used to be a very quiet suburban community into a more urbanized, in many ways, environment. So it's ongoing. And typically these type of events involving firearms were clustered in the more localized, highly inhabited areas in the southern part of the county, but now they're migrating up north into the Germantown area where we've had drive-by shootings. So it's an ongoing thing that we are looking forward and leaning forward to address, and we're constantly addressing it. But like AC Patil said, with the decline in traffic stops and otherwise types of enforcement efforts out in the field, we've seen some of our gun recoveries drop off, but these other events are bringing guns to our attention now. And we're starting to more and more re-engage with traffic enforcement, so we're turning up more and more firearms as we do. There's not a week that goes by that in the duty commander overnight report, you don't hear about 2 or 3 guns recovered during a 7-day period. It's a ongoing crime that's on the rise.
Well, again, thank you for everything that you're doing in every way. Councilmember Albornoz.
Thank you, Mr. Chairman. Well, there's a lot to process there, and that's a number of those items are just colossally depressing, but not a huge surprise, unfortunately, given everything that's going on in the world right now. I want to start on a lighter note, just a shameless, proud husband plug. My wife is the chair of the Family Justice Center's 11K walk and run this year, and she has become very involved along with the incredible First Lady of the Council, Mrs. Katz, in helping to support the Family Justice Center and their incredible work. And to your point, we had heard in previous updates that the level of severity of the domestic violence incidents is extraordinarily alarming. And although the overall numbers are down, that definitely doesn't tell the whole story, as you guys articulated so well. And it is something that we have to be extraordinarily diligent about and make sure that we stay on top of and use every resource at our disposal. We had a joint education and culture and HHS committee around mental health, and we discussed this extensively. And the concern early on during virtual learning of those critical points of interaction between youth who are at risk and teachers or caring adults or SROs who are able to witness and see incidents, and then because kids are not physically in school, they just don't have that same access. And it is obviously something that warrants further attention. I did have a couple of questions. The car theft issue is real. I have had my car broken into twice in the last 6 months. And the first time this happened a couple of years ago, we called our local police precinct, and they were super attentive, incredibly helpful. but also very upfront and honest, saying that there's not a whole lot we can do. And we asked if there would be any value in having them come out and check fingerprints, or would that help in the investigation in any way? And they were perfectly candid and said that, unless a window's been broken, unless there's been some other trauma to the car, that, there wasn't much they could do. What should we advise residents who have had their car break in, beyond taking the proactive steps of locking your car and making sure that the key fobs are in areas that people can't access through technology? But if your car is broken into, what should residents do?
They should absolutely contact the police department. As AC Patil has said, a lot of these calls are being diverted to the telephone reporting unit. But if somebody goes out into your car, you know intimately what you have put in there or left in there. If there are items in there that are not yours, that somebody else might have put there or brought there or left there, then that kind of raises the level of awareness. And also, we have the ability to, based on if there's an ongoing trend in an area, then we can adjust our response protocol. So the more information that people can provide to us when they contact 911, we can tailor our responses. Also, the fact that people like me, I'm a light sleeper. You hear things at night, you see people that are not from your area lurking around doing things, then call us. And I know a lot of people are reluctant to call the police department because they say, the police have a lot to do, but don't feel that way. Call us. It's better for us to come out and address these things on the front end than wait until somebody gets victimized, because everybody knows what is in place or out of place in their neighborhood. And the way that the community can help us solve crimes and reduce crimes in Montgomery County is being good observers. And if you see something, then you need to tell us. That way we can get out there, because sometimes we have, just the neighborhood patrol car, but sometimes if it's an ongoing trend, we have plainclothes assets in the area that we can move in and observe people, because the individuals who are preying on certain neighborhoods do this on a reoccurring basis. Just like you and I and everybody else goes to work and earns a living, this is what they do. So we need to be more diligent about observing who's in our neighborhood. And if you see something, the old adage, if you see something, say something, call us, and we'll come out.
To build on that, we also have a patrol investigation unit that their primary responsibility at each district station is to investigate these crimes, because from a quantity standpoint, they represent a great amount of crime in Montgomery County. They, as Ron alluded to, they often lead to other crimes. A theft from auto may lead to an auto theft, which leads to a robbery or a bank robbery. So, we're a very regionally oriented area. Often in the second district in particular, we'll get the folks out of DC that'll come up right across the line into Bethesda and commit these crimes. So there's a lot of coordination, but we only know what we know, and we really have an opportunity with gathering that data. Sometimes we get a break on a traffic stop or some sort of other interdiction to find a piece of property is stolen from somewhere, and then you start working those cases backwards through that PIU, and you can really start. I want to tell you that it's it's not a 90% closure rate or anything like that, but we do have the right people, and but we just need those opportunities to solve this case.
And I read somewhere that there seems to be a correlation with these auto thefts and people whose homes are close to exits on the Beltway, so that people can kind of get in and out. I live very close to the exit for Connecticut Avenue onto the Beltway, and that when we called a couple years ago and this happened, they let us know that was the case. Is that true? And if it is, how can we more proactively? And I know that you guys are all in and do a lot on letting the public know about these issues, but residents whose homes are in areas that are more pervasive, whether because it's easier to exit or for whatever reason, are there trends like that too?
So I think what it comes down to is a couple things. Sometimes you'll have what I'd say the neighborhood offender, right? Maybe the kids that are sneak out of the house and then go out and they'll do this type of stuff, right? So you have people that are operating in a neighborhood way, and sometimes they'll get that car, they get lucky, there's a key fob in it, then they'll use it until it runs out of gas, and they'll go get the next car in that same manner. But what we will also see is the regional groups that will usually go into a stolen car. There was a video, I believe, in Bethesda a year or so ago, where it showed a crew of young people walking through a neighborhood, and the car had the hatch back up so they could all like dive back in if need to. The kids were just walking driveway to driveway, checking door handles. And those type of groups that have access to a car and maybe from DC or another area, they're typically not going to stray too far from. They're not going to go deep into some neighborhood or some country road that they don't know because it's just a lack of familiarity. So they may just drop off of an exit ramp or come up Wisconsin Avenue and pop into neighborhoods right off those main thoroughfares because again it's the familiarity and how to get back and to where they're going to. But I think other than what I would recommend is not so much focusing on that exit ramp concept because again it can be different. But more, if we can get everybody to lock their car, and when you see the videos, it's so telling. They're not going around usually breaking out windows. They're just trying door handles. And if you get that white run, there's a key fob, an iPad, money, it's payday.
But it sounds like it is worth taking the time to report it because that will help in the investigation and see if there is something more systemic. And who knows if they happen to leave an item that helps direct somebody or connect you guys to somebody that that's helpful. Last 2 points really quick. The ghost gun issue, and I want to give a lot of credit to my Deputy Chief of Staff, Lillian Cruz, on my team, who brought this issue to my attention last year. And she's been doing a lot of research because this is, from a legislative perspective, mostly crosses over to the state. But there's a gray spot here, and we're looking into that because we know that these incidents are increasing significantly, and it is a huge issue and very hard for us to stay in front of. And so I appreciate you highlighting the ghost gun issue, and I'd like to schedule a follow-up session or discussion on that. And our office is working on legislation in that regard, and we'll be partnering with our delegation on that because I think it's very important. And then finally, this is just another comment. I know that the SRO program has understandably generated a lot of discussion and thought and reflection. And I know that we will be having these discussions in greater depth later this month and into this year. And there is no question that given this point in time we are in our community, we do have to look proactively at addressing the concerns of too many of us over the disproportionality of some of these criminal justice challenges. But having said all that, I think the example that you just gave of the SRO officer intervening in a very dramatic and real situation in a high school is not an isolated incident. It's a very extreme example of one, but it's not an isolated incident. And while we don't have as much data as any of us would like on the SRO program, of the diversion, of the contacts, of the referrals of youth to after-school programs and other programs, of the positive connections that SRO officers make, I think the example that was given in this session is a very important one and one to highlight. And as we look at the solution of addressing those very reasonable needs moving forward, we just have to bear that in mind. And it's a comment more than a question, but this will likely be coming back to the Public Safety Committee at some point this year. And I think it's an important point that I don't want to lose. So thank you very much to both of you. I defer back to you, Mr. Chairman.
Thank you very much. Council Vice President Hucker.
Thank you, Mr. Chair. And thanks both of you for the great briefing. I know this comes up every year or two. Remind me why Tacoma Park data is not included?
So Tacoma Park, and I won't say I understand because I know that they are a unique jurisdiction within the county and how they're structured with
in many ways
the rebate. In many ways, best way to put it. Their information is they dispatch their own folks, even though they use a lot of our technologies. They report separately. For incident-based, reporting and different things. So I can get you a better answer, but the kind of short answer is that they're the most autonomous municipality that we have, and so there's rules that kind of apply to that.
If you don't, it might bore everybody else, and the former mayor may have a lot of knowledge on this topic, but yeah, I'd love to have a fuller answer to this. I knew they do their own dispatch, but that should be a different question. That shouldn't result in not sharing the crime data, right? So,
sure, I get it for you.
I would love to both see it, disaggregated, and also, how it affects this, because as their local representative, I should probably be more on top of it. And I hear about it anecdotally, but not from a data point of view.
Sure, absolutely.
Thanks. Can we confirm what AC Smith said for car thieves? Your understanding is this is their primary source of income. Is that your point of view? Sounds like it.
I didn't say it was their primary source of income. I said this is what they do. A lot of the people that we're dealing with are younger people in their late teens, early 20s. And in many cases, what we've seen is that they're people who are primarily committing thefts from autos.
Yeah.
And just the attractiveness of people leaving their keys or their key fobs in their cars that are unlocked just makes the cars more prone to be stolen. So not that this is their primary source of income. Now, we have dealt with in the past organized groups that are specifically targeting certain areas in Montgomery County that were based out of the District of Columbia, where we knew pretty much if a car was stolen, where to go and look and where to recover it. But these are just a lot of young people who are going through our neighborhoods, just like AC Patil said, and they're just trying the cars that are unlocked. And sometimes they hit the jackpot and the keys are in them.
Right. I just wanted to clarify. That's they're practiced at it. They're skilled at it. They do it all the time. But that's not what you meant by that's what they do.
No.
I just because I don't have an opinion. I'm trying to learn about this. Okay. We had a recent whole spate of these in my neighborhood too, also off the Beltway. One night, a neighbor had his car driven away by one of these groups over to a park where they were going to do whatever they were going to do with it, and then he drove his other car over there and confronted them with a bat in his flip-flops or something, and things didn't go well. We generally don't want our residents to do that, right? Let you do your job. But then the same thieves, we think, were back.
You just froze, Tom. Tom, are you there?
Somebody just stole his internet.
Yeah, you're frozen. See if I can get him back.
We'll just note one quick thing while there's a lull in the action that, because we didn't hit the numbers, but when Ron was talking about guns and gun crime, we have seen a 5% increase over last year in shootings, and weapons offenses in general are going up. So it's something that the gun issue is a pervasive and something that's on the rise. So we need to keep an eye on. So the details are in your briefing packet.
Thank you. I know that he's now off, and maybe he's trying to come back in. So let's give him a minute or two to see what's going on.
One of the things to add on to also is that many of these theft from autos or auto thefts are parts of what we refer to as a spree, in that they hit an area, they get a number of cars, and then they leave that area. But as AC Patil alluded to, our Patrol Investigations Unit, with primary looks into these, in cases where they can make an arrest, they can close out multiple events through one arrest. Because sometimes we are lucky enough, we make a traffic stop And then there's evidence from multiple car thefts or thefts from auto in one vehicle. So when we are able to close these cases, we're not just closing one. In most of the time, we're closing multiple events because it's somebody who's targeted an area.
Okay. Thank you. Let me see if he can. His internet just went out, and I don't know if he's able to come back in some other way. So let's see what we have here.
Okay.
Cue the Jeopardy music.
Okay, well, he's saying he's trying to restore it, but we shouldn't wait. So we are having another session on, I think, October 29th. Wasn't that the next date for this continuation of this discussion? So any further questions that Council Vice President Hucker has, I'm sure he will not be shy, and we'll ask him at that time. So I think that's all the questions that we do have at this point. So we do thank you all again and again and again for everything that you're doing. We look forward to continue to work with you, and any types of resources you do need, please do not hesitate to let us know. And with that, we are going to leave this meeting. So we are adjourned. Thank you very much. Thank you.